For so long, women have been silenced in so many different aspects of life, but also when it comes to their health. It's a matter of life and death.
For over 10 years, Dr. Tosin has been a doctor and is now one of the most recognisable GPs and women's health advocates on TV.
Black women are 2.3 times more likely to die during pregnancy. I was no longer just a number or a possible stat. This was my reality. Women's health, when it comes to certain ethnic groups, we are still far behind. I didn't realise how little people know when it comes to their health.
In this episode, we will talk about how to set boundaries, advocate for yourself, and ask your doctor for better answers.
I don't think I realised before I was a doctor. Diagnosis is...
It's a very, very dark reality. You really, really have to push. And you have to advocate for your health because no one else will, unfortunately.
Why is it, do you think, that women have to advocate for themselves more than men? If you've ever felt dismissed by a doctor, struggled to set boundaries, or found it hard to speak up for yourself, then you are not alone. In this episode, Dr. Tosin shares practical tips to help you advocate for yourself, ask for better answers without guilt, and feel more confident going to see your doctor. But first, don't forget to subscribe or leave a 5-star review. It helps us massively and it will only take you 2 seconds. You can do it right now. Thank you. Dr. Tosin, you have an incredibly busy life balancing being a GP, a TV doctor, and a mum. What did Dr. Tosin want to be doing when she was 5 years old?
Oh gosh, it's probably not going to be the answer that you're expecting. I wanted to do anything and everything. At one point, I wanted to be in the army. I made my mum enroll me in army cadets. And I got there. I lasted about 3 weeks and I realised it probably wasn't for me. One point I wanted to be an interior designer. I spent the whole summer looking at houses and drawing different, layouts of different rooms. I think at one point probably wanted to be a fashion designer. And then I got to around age 12, 13, probably a little bit older, maybe 14. And it must have been a teacher that said to me, you're good at biology. Have you ever considered medicine? And at that point, I hadn't. Although I'd grown up in a healthcare family, my parents are both pharmacists, I kind of went away from that world. I thought, I don't want to be doing what my parents are doing because who wants to do that? It's not cool at that age. So I hadn't really considered it. And then I did a couple of work experiences and I just completely fell in love with it. The fast-paced nature of being in a hospital and looking after people that are sick to actually being on the other side and seeing people get better and being able to make an impact in people's lives. The rest was history from there.
There were so many questions about how to navigate just the healthcare system in general. So I'm really excited to talk to you about some actionable tips that people can go away with to help them navigate their GP appointments or feeling dismissed or not listened to by their GP. But I also want to talk about what led you to women's health. Is there a patient that springs to mind or a story that motivated you to focus more on women's health?
I think it's a combination of a few things. Primarily, really, my world outside traditional medicine came from a place of frustration. I loved what I was doing working as a GP, but very early on in my career, I started to feel a bit frustrated and I started to feel like I wasn't doing my patients enough justice. We have 10 minutes and that's not enough time it's just about enough time to give your patients what they need in terms of treatment, investigations, but it's not enough time to really educate them on just the basics of how they should live, the basics of their body, the basics of living a healthy life and understanding their body. And I thought, how can I educate as many people as possible? Because I can't do that in my consultation room. So I decided to go outside the four walls of my consultation room, start sharing little bits of information online, going into workplaces, schools, anywhere that would take me. And from there, I started to get lots of questions from women about different things, their period, perimenopause, menopause. And I started to think, how do you not know this information? And it dawned on me that we're in a position of privilege where we have been educated on this. So yes, we know more than the general public, but I didn't realize how little people know, especially women, when it comes to their health. And it's because we have not educated them. And that's doing them a huge disservice. But then the complicated puzzle gets even bigger when I started to realize just how under-researched, underfunded, overlooked women's health is. And I thought, if I can be a part of just changing that dial, I want to be a part of it. So really that's what got me involved in women's health. And I think now having a daughter has just made that passion and fuel even stronger.
I don't know if you agree, but I think one of the biggest issues that we have in medicine is being a doctor is quite an insulated profession. A lot of people who become a doctor, their parents are doctors. You obviously make incredible friends in medical school, which means a lot of your friends end up being doctors. And doctors can be quite detached, I think, from the general public. So you saying that you were confronted by how little people knew really, really resonates with me, because it sounds a bit weird to say, but when you're not in touch with the general public that much, you forget that. So I have it, say if you're a hospital doctor, for example, and you only see very sick people and all your friends are doctors, you don't have exposure to the really, really poor health literacy that the general public have.
Yeah.
My group of girls from home, sometimes they come to me with questions and I have the same thought, because we take for granted what we have the privilege to know. Something I'm really excited to talk to you about is how people can educate themselves in this world of misinformation. But first, we've got a community question that I would love to hear your thoughts on. Why is it, do you think, that women have to advocate for themselves so much more than men? And why do you think women's symptoms are often narrowed down to emotions?
I think the answer is so layered, but for so long, women have been silenced in so many different aspects of life, but also when it comes to their health. And it's so sad, because that's definitely the area where you should not be silenced, no matter who you are, because it's a matter of life and death. But, we've been silenced to the point where, women feel ashamed to talk about some of their symptoms. There's stigma attached to very normal things such as periods, perimenopause, lots of reproductive health conditions. There's stigma attached to fertility problems or infertility, when we know that it's 50-50. It takes two
to tango.
Exactly. And just the pure silence, if we don't talk about certain conditions, if we don't talk about periods, if we don't talk about menopause, you're implicitly saying there's something wrong with those things, that you shouldn't talk about it. And I think this rhetoric has been around for decades and decades. And yeah, we're seeing it change. We're definitely seeing it change, but there's still a long way to go. I think about when I was in school, and I went to an all-girls school, but yet I still remember when it was that time of the month, sticking a tampon up my sleeve or putting a pad down my skirt, and everyone did the same thing. And it's crazy when I look back, because it was an all-girls school. We were all going through the same thing. So what was there to be embarrassed about? Nothing. But it was the pure fact that no one spoke about it. So we all felt like, oh, this is something that you don't talk about. You don't talk about when you're on your period. And I hope that's changing a little bit in schools. I hope people aren't ashamed. I hope we're having open conversations. I hope there's pads and tampons freely available for girls in school toilets, because there definitely wasn't back in my day. And I'm not that old, shall I say?
Well, I hope it's changing as well, because I think about the first time that anyone spoke to us about periods and they split up the boys and girls. It's from that moment, the first conversation, it's shame. And I had my first week of uni this week, and one of our lecturers asked us to put our hands up and say how many lessons over the course of our education we'd had about periods. And how many do you think most people said?
Oh, gosh. Are these mostly medics or?
No, a big mix.
Okay.
A big mix. But mostly women, but a big mix. Yeah.
An average, maybe 5.
1 to 2.
Wow.
Yeah, 1 to 2. Your cycle affects every single aspect of your life, not just that 1 week you're on your period, yet 2 lessons over the course of their education. It's just wild.
It's wild, but it doesn't surprise me. And I think I was being optimistic by saying 5, because it doesn't surprise me at all. It wasn't until 2020 that in England it became mandatory for boys and girls to receive menstrual health education in schools.
2020.
So before that, you could kind of do what you wanted. Yes, you could teach them if you chose to. Yes, you could not. So that's 5 years ago. It's crazy.
And I think it's really interesting that the focus of PSE lessons, or whatever they call them now, tends to be stopping you getting pregnant, which is important, obviously. It's not great having a baby when you don't want one, but that is so heavily the focus when there is so much more to learning about your body and your reproductive health, especially as a woman, that just seems to be glossed over. But hopefully by the time your daughter grows up, then it will be different.
Gosh, I hope so. I hope so. The optimist in me says that it will be very different to when I was in school. But I think you're so right. And it's one of the banes of my life or my career in terms of, you're taught how to not get pregnant, and you're taught when it's time to get pregnant, it's this Cinderella or movie scenario where boy meets girl, you do the deed and you have a baby. However, a lot of people don't find out until it gets to that time of, okay, I want to start a family, that there's a lot more to, I call it the fertility puzzle. And it takes so many different pieces to come together at the right time to get pregnant, 2, carry that pregnancy to term, and then 3, give birth. So I think we definitely need to be having the conversations earlier on at, using the right language that children can understand, and then changing that language as they get older so they can understand more and more. But definitely the conversations need to start for both boys and girls at a younger age so they can be well informed and well equipped as they go through life.
Yeah, 100%. It's really incredible seeing people like you and other doctors as well finally having the confidence to be on social media, because if Donald Trump taught us anything in the last few weeks, it is that we are losing the war to misinformation on social media. And I think that so much of that stems from doctors rightly feeling a little bit apprehensive and anxious about putting themselves out on social media. But, we absolutely do need more voices like you, reputable voices. Is there any advice that you have for women who are listening right now who are finding it really, really, really difficult to navigate social media at the moment when there is a new wellness trend, a new supplement or piece of advice that keeps cropping up every day, and it seems like every day it's conflicting advice as well? How do you navigate that?
I think it's difficult. I have a love-hate relationship with social media, and that sounds odd because I am on social media, and it's afforded me a lot of things in life that, I didn't even think were possible as a doctor. But there's no barrier to social media, which means anyone can go online and speak about any topic, really. And sometimes it's difficult to tell if that topic is true, if what they're saying is fact or fiction, and the expertise of that person. So I always say use social media and what you see or what you hear as inspiration to then go off and either do your own research or speak to a doctor. Don't take anything as fact, and definitely don't take any treatment or medication or management advice off social media, even if it's from someone that says they have certain credentials, even from doctors. I would say go to your own doctors. Doctors should not be given personal medical advice. Yes, they can speak about different health conditions, and hopefully that sparks maybe a conversation, or hopefully that sparks, hold on, I have those symptoms. Maybe I need to go and see a doctor. But please don't take anything as fact that you see on social media and just use it as a spark of inspiration to then go off and either A, do your own research, or B, speak to a doctor.
Yeah. Something I hear a lot of, which I'm sure you do as well, whenever I say on social media, go and speak to your doctor, what I hear a lot is I can't get a doctor's appointment. When I go to the doctor, they just dismiss me. Or when I do go to the doctor, they just Google it. So I want to go through some of your GP green flags and GP red flags. Maybe let's start positive. GP green flags.
I love this question, although I'm a little bit nervous it will get me into trouble. Okay, GP green flags. So essentially, you want your doctor to listen to you.
Yeah.
And you want your doctor to also advocate for you. You have to advocate for yourself when it comes to your health, because I always say, you know your body the best. But your GP or that doctor that you are seeing in that appointment should be your advocate. They should be thinking, okay, how can I understand what is going on with this person? How can I get them the help that they need? How can I get them the management or the treatment that they need? Your GP should be listening to you. You know, that first minute of your appointment is the golden minute. They should be listening to you and allowing you to speak. And if you feel as soon as you've entered that consultation room, your doctor is doing all the talking and you're doing very little of it, that's not a green flag. I've gone on to red flags, but that's not a green flag. So your GP should be listening to you. And it should be a collaboration. I think sometimes people they have this invisible kind of line between a doctor and a GP, but it should be a collaboration. You know your body the best, but your doctor knows medicine the best. And it should be a communication, a journey between the two of you to find out what's going on. You're on the same team.
Yeah. Yeah. And I do you know what? I think what's a really, really difficult thing to ask people to do, but I would encourage everyone listening to do, is go into your appointment on a clean slate. I personally have had bad experiences with doctors as a doctor myself, so I'm not dismissing the bad experiences that other people have had with doctors, because, you know, I've been there as well. You have to try and walk into a new appointment with that clean slate, and at least with the belief that you'll be on the same team. And if they prove you wrong, then they prove you wrong. But starting things off on that right foot, I think, is really, really important.
I think so too. And I think it's such great advice. But, you know, the reality is it's difficult to do sometimes, especially when you feel like you have not been listened to or when you feel like your symptoms have been put to the side. It's really difficult to then go for the 4th, 5th, 6th time with optimism. So I understand people. I understand when patients come in and I can feel that they're cold, or I can feel, you know, they're not happy right out the door. Because not only are you dealing with the emotions of maybe not feeling like you're listened to, you're also dealing with the emotions of possibly being sick, the physical symptoms of feeling sick, and the emotions of not knowing what's going on inside your body. So all of that is a huge, huge weight to carry. And then add on the fact that you might have been waiting for this appointment for weeks, sometimes months. So I completely understand when someone comes in and they are fed up. And I have to give that person the space and the understanding and listen and meet them where they are and allow them to feel comfortable and allow them to feel, okay, this is a fresh slate we're starting here. Even though it's a 10-minute consultation, I feel comfortable with this doctor to say what's on my mind. And I think there needs to be some expectation that in a 10-minute consultation, you might not get everything resolved. And often with chronic conditions, you won't. It's a journey. You know, yes, if it's a cold or maybe a cough or a chest infection, we can manage those within a 10-minute consultation safely. But if you're dealing with a chronic condition such as possibly undiagnosed endometriosis, it might take a few consultations, going away, tracking your symptoms for a few months, doing some investigations, ruling out other conditions before we get to an answer sometimes, unfortunately. And I think it's understanding that, but it's also the doctor explaining that clearly to patients. So you should leave that doctor's room understanding what's happening next, and whether that might be, okay, I have to wait for these investigations to come back, or the doctor said he's going to go away and maybe speak to a specialist to understand what the next steps could be, or I'm being referred, or blood tests. Or actually the doctor's going to go away and call me back because they maybe want to do some reading and understand something a little bit more, because this could be something that they don't see every single day. So I think it's just understanding, having expectations, but also the onus is also on us as doctors to explain that very clearly to patients.
Yeah, I think a GP green flag I would add is someone who admits when they don't know something.
Yes.
Such a green flag. And I think that often there's this perception that you go to medical school, you pass your exams, and suddenly you can just regurgitate every piece of evidence that exists about the human body. Science is always changing, research is always evolving. We're human beings at the end of the day. Some of the best, most intelligent doctors that I've worked with have been the ones who hold their hands up and say, you know what, I need a little bit of a quick refresher. I haven't covered this since medical school. Give me some time, but I'm going to do my best. Which neatly brings me on to a big complaint, I think, that we often hear is, my GP's Googled. How do you think you navigate that as someone who's, you've been waiting so long to get an answer? You see your GP Googling, and maybe it makes you feel that you're not in safe hands.
First of all, it's really important to talk about, because I think it makes a lot of people anxious, and it creates a fear that maybe the doctor that they feel like they should trust doesn't know what the hell they're doing.
Yeah.
But actually, it's the other way around most of the time. And your doctor isn't necessarily Googling. They are most likely Googling those guidelines, whether it's, we use NICE guidelines in the UK. They're getting up those guidelines so they can make sure that they are doing the right investigations, they're following the right management plan that's recommended, or they're looking at other differentials that it could be. And again, sometimes you just do need that refresher. We see, as GPs, we see everything and anything. And we know a lot, but we don't know it all. And we see a lot of things all the time, and we see some things hardly any of the time. So sometimes you do need that refresher. And like I said, it's often not Googling, you're getting those guidelines up so you can make educated and informed decisions for the care of your patient. But what I always do is I often explain to the patient what I'm doing. Because it's weird when you have a patient, you're a doctor, and you're just typing on your screen and there's silence.
Yeah.
And the patient's sitting there thinking, what's going on? So I always fill the room with talking, sometimes maybe too much. But I say, okay, I think it might be this, but I just need to check the guidelines. I need to make sure we're doing the right investigations. I think this is an antibiotic that I want to prescribe, but I just want to double check, make sure we're giving you the right dose. Or I think this is the next steps, but I just want to double check what the guidance says. And sometimes I even turn the screen around and I say, okay, look, this is what the guidance says. This is what I think might be going on. And the guidance isn't there to say, this is exactly what you should do.
Yeah.
Because everyone is different. Human bodies does not work like that. But it gives us some kind of framework to go on. And then with the patient in front of us, we can use the two to decide what might be going on and put the different dots together. So hopefully that relieves people's worries and fears. That's my own perspective. But if you do feel uncomfortable and you feel like your doctor may not be, I guess, honest in a way with you, and I think you touched on something really important there. The best doctors are the ones that say, I'm not sure about this, but I'm going to go away and find out. And actually, as a doctor, when I realized that A, I could say that, and B, the power of saying that, it took such a huge weight off me as a doctor. I think I realized that very early on in training. And once you realize that you don't have to know everything, there's specialists, there's seniors, there's books, there's guidelines that will help you, and that's what they're there for. it just made me feel relaxed. You know, I could call a patient back the next day and say, look, I've gone away, I've read X, Y, and Z, or I've spoken to X, Y, and Z specialists, and this is what I think might be going on. Instead of trying to figure out everything in that 10-minute consultation and then going to sleep at night and thinking, did I say the right thing to that patient?
Yeah.
Did I fill them with too much certainty that it is definitely this, when actually I'm not sure if it is? So once I realized that I could actually be very honest with my patients and saying, I'm not sure at this point in time, but I'm going to find out.
Yeah.
That took so much weight off my shoulders.
I literally vividly remember the time when I realised as well, because I had a consultant who is internationally renowned. She has published a ridiculous amount of research papers. We had another consultant who'd come all the way from New Zealand to shadow her, like just a proper big dog in her field. And we were sat in a meeting, and I vividly remember her saying, oh, I'm not too sure about that. I'll have to have a little read. And I, listening to someone who so many people admired, her just in a room full of people say, I don't know. And it was so incredibly liberating. And if anything, I trusted her even more, because you know that she's not going to pretend. Another point I did want to touch on is you talking about giving patients too much certainty that something is a disease or a diagnosis. I don't think I realised before I was a doctor that diagnoses most of the time are best guesses. There are obviously investigations that can be done to confirm, you know, what we think. But a lot of the time it's just us trying to piece together lots of different pieces of information and doing the best that we have, because we can't cut you open right there in front of us or do a biopsy of everything, or, you know, for endometriosis, to get a diagnosis, a concrete diagnosis, you have to cut someone open. A really important thing for people to know as well is a diagnosis a lot of the time isn't concrete and fixed.
Yeah,
Yeah.
definitely. I mean, like you said, sometimes it is, you know, when we have that certainty and that information, we've done a biopsy, we know it's this. But a lot of the time, we call them working diagnosis in the medical world, because we are still working it out. We're still trying to understand if it could be X, Y, and Z. But this, like you said, is at the top of our list. So this is what we think it might be. And this is maybe what we might start treating you with. But there's a possibility it could not be, and it could be something else.
Yeah. You've done some incredible things in your career. Some may argue, most interestingly, being on embarrassing bodies. But you've also done so much work with femtech, and I'm really excited to come on to practical tips that you can give listeners on how to navigate the world where it seems like there's a new women's health product cropping up everywhere. But first of all, I've got another community question. What practical tips can you give women for advocating for themselves in a doctor's appointment?
Good question. Very good question. I would say, first of all, prepare for your appointment, or go into your appointment as if you're preparing for a meeting. And I know it sounds very strange because they're two very different things. But if you think about a meeting, you would go in knowing the points that you want to say, and sometimes having an idea what you want to get out of that meeting. And I think we need to prepare the same way when we're going into a doctor's appointment, because sometimes we get in front of a doctor, even myself, and you forget everything that you want to say. And then you leave that doctor's room and you're like, oh my gosh, why did I not say this? I didn't tell them about this symptom. Maybe that could have changed what they're going to do next. And then you might not get another appointment for a good couple of weeks. So it's really important that you prepare. And if that means writing things down, write it down. I have to write everything down. And your doctor's not going to look at you sideways. In fact, it's actually very helpful because we know that you've probably not missed anything that you want to tell us. Track your symptoms. We have so many different tools these days, especially when it comes to period trackers. And often they're not just period trackers. A lot of them you can also track other symptoms, your mood, pain, your urinary symptoms, bowel symptoms. And I think that's super helpful because often some people may not think that one symptom is associated with another. If you think of endometriosis, for example, people think of it as just a reproductive condition. However, it can affect lots of different organs, and therefore it's a whole body condition. And therefore, you may not think that your fatigue or your bloating or your pain when you're having sex or urinating is related to possible endometriosis. You may not give that information to your doctor. But if you've tracked all those symptoms, we can look at that information, and then it's our job to connect the dots. So I think tracking your symptoms, or at least writing them down in some way, super, super important. Thirdly, if you feel like you're not able to advocate for yourself, or if you feel that you can't get across everything you want to in that appointment, bring someone with you. Bring someone you trust. That might be a friend, a sister, mother, brother, your husband. It's your appointment. You can do what you want with that appointment. I often say that, and people are like, I can bring someone with me to my appointment. Of course you can. Bring your whole family if you want. Although I'm not sure how well that will go down. But yeah, do what you need to make that appointment the best possible that it can be for you. And then lastly, I said this before, but make sure you leave knowing what the next steps are. And that might be, scans, it might be an appointment, it might be a second appointment with your GP, but make sure you leave knowing what the next steps are. And if you leave and you feel like you don't know what the next steps are, book another appointment. Even if it's just a phone call to ask questions, super, super important that you're not left in the dark and you're left pretty much on the same page as your doctor. Because what you don't want to happen is your doctor is thinking one thing and you're thinking another thing. And let's say you get a letter for a scan and you're thinking, why the hell am I having a scan? I thought everything was fine. So it's really important that you leave understanding what your doctor's thinking and what the next steps are. Don't be afraid to ask questions as well.
Yeah.
People feel like maybe asking questions is being difficult, but it's not. It's just making sure you understand your health and you're well informed about your health and your healthcare journey.
I haven't heard that point before, the making sure you know the next steps. That's a new one that I'm going to add to my toolkit when anyone asks me that question, because it's so important, just closing off that with clarity. Because also I think something doctors, including myself, can be guilty of is we know what the next steps are. We know why we're taking those next steps. It's second nature almost. So we take it as obvious, and, sometimes we might forget to explain it, but by asking questions, you're highlighting the gaps that you want filled and you need filled. So I really like that one. Another community question that we got was, how do I advocate for myself specifically when I'm getting really painful periods and my doctor wants to put me on the pill?
It's a common question. I'm loving these community questions because I feel like lots of people want to know the answers. And first of all, when it comes to painful periods, I think it's important, if everyone doesn't already realize, that painful periods are not normal. And no one should tell you that they are. There's a difference between cramps and pain. Cramps when you're having a period are normal. It's the body's way of basically the uterus contracting to dispel the lining of the womb, which is what we see as our period. However, pain where you are having to take painkillers round the clock, where you're having to miss school or work, where you are being sick or feeling sick, is not normal. And yes, a lot of women get pain during their periods or around the time of their periods. And I think that sends a message that it's normal. But just because something is common does not mean that it's normal. So that's one thing that I want to get across, and hopefully everyone takes away from this. But in terms of, your doctor possibly suggesting the pill for period pains, now it is a legitimate management option, but there's a lot of steps before we possibly get there as just one possible management option. And the first step is understanding what might be causing this pain. And there's so many different possible scenarios, you know, possible endometriosis, possible adenomyosis, fibroids. And it's a series of investigations taken a very thorough history, including family history, how long your symptoms have been going on for, what other symptoms you're experiencing, for us to then understand what could be causing the pain and then reach possible management options. And the pill is a possible management option depending on what is causing the pain.
I think the pill gets demonised a lot on social media. And we had Dr. Nagler on, and she was explaining that the pill is often seen as a plaster over a gaping wound of painful periods. But if you do get investigations and it is likely to be endometriosis, then there are benefits to being on the pill with endometriosis. And I don't think that's spoken about enough on social media. It does feel as though it is demonised a little bit. If someone is in their appointment and they feel as though their painful periods are being dismissed, what steps would you recommend that they take?
I think it's basically saying that.
Yeah.
Being very upfront. I know sometimes it's not easy when you feel like you're in that pressured 10-minute appointment and you have a doctor telling you that your pain is nothing to worry about. But at that point, you should say that you are worried and why you are worried and how it's affecting your life as well. And if you still feel like you're not heard, get a second opinion. And I feel like we don't encourage this enough. But you are entitled to get as many opinions as you want. And I encourage it. I encourage someone to get a second opinion. Easier said than done, especially in this current state of our healthcare system. But you do have to push. Sometimes you really, really have to push, and you have to advocate for your health because no one else will, unfortunately. There are people that will hopefully advocate along your health journey, and that's what us as doctors, nurses, midwives are there to do. But your health is also your responsibility. So if you feel like you're not being listened to, go elsewhere and get a second opinion.
Do you have any tips for how to do that if you're a bit of a people-pleasery woman? I feel like as women, we are incredibly guilty of avoiding speaking up. Any actionable tips you have on that?
Look, it can be difficult. I don't want to sit here and say, you know, go and get a second opinion. It's easy, because I've also been a patient many times. And when I think about, you know, the times that I was a patient, for instance, going through pregnancy, you're already in a vulnerable position because you're already not feeling your best. There's so much uncertainty. So it's really difficult when you're in a vulnerable position to show up and kind of push forward and advocate for yourself. So I would say if you do feel like you're not able to advocate for yourself, or if you're a people pleaser, that's when you need someone else with you. I think that's when you need to bring someone that can advocate for you, or you need to speak to someone that you feel can advocate for you. I think super, super important. And there are steps that you can go through in terms of the NHS system. If you have a complaint, or if you feel like your doctor's not listened to you and you feel like you need to get a second opinion, not sure how, speak to your GP practice manager. And hopefully they should guide you in how you can do that.
Yeah, a bit of a controversial one from me, but any of my friends who have a bad experience in any healthcare related situation, I always encourage them to go through the complaints process. Super controversial. But I think that hopefully those are the things that end up making positive changes, bringing those issues to light so that they can be avoided happening again. And I think often when we have a bad experience in healthcare, it makes us want to retreat into our shell and be quite avoidant. But if you do have the energy, I think it is, because you can help other people by raising these issues. I mean, that's my personal opinion.
I don't think it's controversial at all. I
Fine.
think that's the only way we learn.
Yeah.
If we know where something we're not doing something well, or something has gone wrong. And when it comes to, dealing with people's health, It's so important that we know when we might have done something wrong. And if people do not complain, we may not know that we may not have done something well or we could improve. So 100%, everyone complain.
Yeah. And I think that just shows that, I think a good doctor is not going to take it personally. A good doctor is going to be able to separate their personal emotions and take it as constructive feedback and see it as a way of getting better, not, go in a corner and sulk.
Yeah.
So yeah, maybe that's another red flag.
Yes, yeah, definitely. I mean, it's difficult as a doctor as well because you've gone through so many years of training, and I think a lot of people have gone into medicine thinking that all you want to do is help people. And there's so much pressure on you not to make a mistake and to get everything right, because you just want to make people feel better, and it's people's health. So the stakes are very, very high. So if you get a complaint in, and it's not if, doctors will get a complaint in, at least one. And if you're not getting complaints, I would question some things. Or if you haven't had one complaint in your whole career, or at least one conversation that may have made you feel, oh, I could have done X, Y, and Z better, then either you're just amazing or something might not be going right there. Because I think, like you said, we're human. We are going to make mistakes, or we could do things better, and we need to be able to learn from those things. But definitely when you get a complaint through, especially your first one, you feel like, oh my gosh, is this the end of the world? Like, have I made someone feel X, Y, and Z way? Because that's never our intention, but we are human.
Yeah. You've done some really incredible work for communities from the global majority. And actually, when we talk about women's health, I think it's really important to highlight that women's health is made more complex by various different backgrounds. I want to come on to that, but first, I want to see what advice you would give for, say, a woman who she's been to a GP and she's been referred to gynecology. She's waiting for an appointment. She's waiting for answers. She looks on her phone and there is a new app, a new supplement, a new person selling a guide online. How do you recommend she navigates that space whilst she is desperate for answers? Because I think there's so many incredible apps and incredible supplements and incredible guides out there, but it can be really difficult to know which ones are worth the money and which ones aren't.
Yeah, it's so difficult. It's the wild, wild west online.
Yeah.
And you don't know what to trust, what supplements you should or shouldn't be taking. Again, I would always look at the source. So who is behind that product? Is it a trusted team of healthcare professionals, or at least making sure that there is someone with credentials involved in building out that product? If it's an app, who's behind the app? Do they have doctors on the team? Is the information up to date? We can read articles and apps, but when was that information last updated? These are the guidelines when it comes to postpartum care or feeding your baby. When was that guideline last updated? Because things are changing very, very fast when it comes to healthcare. So making sure that the information is up to date, making sure that the people behind the product are experts in that field. And in any case, if you're ever in doubt, always speak to your doctor. And I know sometimes people are like, well, that's a waste of a doctor's appointment. And it's actually really not. Some of my best appointments are when people come to me just to ask questions. I had a lady and she said, I had a baby and my breasts have changed since then. And I know I'm meant to examine my breasts every month or regularly, but now I don't know what my new normal is. I'm not sure how to examine my breasts. I see all these things online, but people are doing them slightly different ways. And we just spent 10 minutes going through a breast exam. And it was great because that's preventative healthcare. I've given her information that is hopefully going to allow her to understand her body better and her normal better. So she's in a better position to spot something if it changes. So I think booking appointments with your doctor to ask them, do I need to take this supplement? Would you say that I need this app? Do you think this is a good period tracker? How do I examine my breasts? Amazing. Please do it. More people need to do that.
I think that's such an empowering message. And where the NHS can so often be very reactive and trying to cure things, I think we can all do with being a bit more preventative when it comes to our health. And I really, really love that. I think if there's anything people can take away from this episode, it's that feel empowered to ask your GP these questions, because actually you're saving resources later down the line. If you take a supplement that you don't need, and supplements are not benign, some supplements can do harm.
Yeah.
If you take something that is doing harm, you are creating extra work for the NHS in the long run. So I think that asking your GP questions, is a really good take-home message. I would love to come on to the work that you've done for global majority communities and also your experience as a woman. I think that having recently gone through pregnancy, there has been a lot of headlines about the Black maternal mortality rate and just the Black maternal experience in general. Do you think that affected your experience going through pregnancy, or did you have any experiences that were quite tough?
Yes, it's really interesting to reflect back on that period, because when we talk about the Black maternal experience, it's very real. We say these numbers very easily. At one time, women were 5 times more likely to die during pregnancy or shortly after. Currently, Black women are 2.3 times more likely to die during pregnancy or shortly after. It's not acceptable. The disparity is still huge. People think, great, the numbers are getting better, but these numbers are real people. They're real lives. And I think that was brought to light during my pregnancy, because I was no longer just a number or a possible stat. This was my reality, that I could be one of those people. So I definitely felt it every stage of my pregnancy. And it made me advocate for myself even more. And I'm in a position of privilege. I'm a doctor and I use that doctor card throughout my pregnancy. I was talking to someone about this yesterday, whether you say you're a healthcare professional when you're going through the healthcare system. And sometimes there's no need to, but I think sometimes where the stakes are high, and when you know that you're already at a disadvantage as a Black woman, to me, I used any power that I could. And do I think that the treatment that I got was different? Unfortunately, probably. People a little bit more aware, maybe a little bit more cautious, because they knew that I had a healthcare background, or they knew that I understood a little bit better what was going on. And it also made me a better doctor. It made me have more empathy for my patients, because there were times where I sat in consultations during my antenatal care and I thought, if I wasn't a doctor, I would be so confused right now. I would not know what you are saying to me. All this information is too much to take in too fast when you're already in a vulnerable situation. So I think it made me practice as a doctor differently. And it made me a better doctor. But the disparities are very real, not only the maternal disparities that we see between Black and white women and Asian women, but, across the board, Black women are more likely to suffer with fibroids. And not only that, they're more likely to have debilitating symptoms from fibroids. Black women are more likely to have a very aggressive form of breast cancer. So many disparities that I could go on and on about. Do we know why these things happen? We're not there yet. Women's health is under researched and we're just playing catch up. But women's health when it comes to Black women and certain ethnic groups, we are still far behind. It wasn't until 1993 in America that a law was passed that said women must be included in clinical trials. And before that, women of reproductive age were often left out of clinical trials. However, that's not the whole story, and people stop at that. But the law was that women and minorities must be included in clinical trials. Because before that, not only were women left out, but minority groups were left out. So as a Black woman, we are the last people that they think about when it comes to research. So there's a huge amount of information that we don't know in terms of, you know, how certain processes might be different in bodies, how certain environments, certain cultures certain foods might impact certain health conditions. These are all really important, but we don't have the information, we don't have the data where we can then have better healthcare outcomes and change women's lives, really.
I didn't know that about it was 1993 and it wasn't just women, it was minorities as well, because the conversation around women's health, you know, over the last few years has absolutely boomed, but I don't think we've seen enough of the nuance placed on how different women experience women's health. Are there any actionable tips you have for other women who are navigating the complexities of being from different backgrounds and feeling like they're treated differently?
It's difficult. And again, it comes back to advocating for yourself, because no one else will do it for you. And that's harder when you're already, you know, playing catch up as a Black woman. Sometimes it does mean seeing a doctor that you might be able to relate to, or that you feel can relate better to you. Not all the time, but sometimes that does make a difference for certain patients or maybe certain situations. So I think if you feel like that could help, and that's unfortunately not everyone's going to have access to that. In London, we live in a little bit of a bubble where it's very diverse. You step outside of London, you don't come across doctors of colour that much, or at least Black doctors, Black female doctors, even less so. But if you have access to that and you feel that it may make a difference in your healthcare journey, seek that out. Secondly, I would say there are lots of, you know, community groups, social enterprises doing amazing things. There's 5 times more the motherhood group who are advocating for women and maternal health care. And they have some, you know, great communities that you can either join or reach out to. Tommy's, they have a maternal healthcare helpline, but specifically for Black women.
Wow.
Which is amazing. So if you're a Black woman who needs support during pregnancy, Tommy's is great.
Yeah.
So there are a few people doing and few organisations doing amazing things that people can lean on for support.
Yeah.
But, you know, it's not easy. I won't sugarcoat it. It's not easy.
I had 2 patients where it really hit home, the complete inequality of it. I was working a palliative job and there were 2 women who they were both had quite advanced cancers. They were on the same ward. One was a white middle-class woman. The other one was a Black middle-class woman. And I saw them both on the same day. I went to one of them and she was leaving and she said to me, "I'm so grateful. Every time I pressed my buzzer and said I was in pain, people couldn't come quick enough." The other patient I went to go see, and she said, "Oh, do you mind just asking the nurse again? It's just I've been asking for my morphine for the last 6 hours." And she was so unbelievably polite. And what actually I think is really important to know is the first woman knew what she wanted and she was very firm in what she wanted. Whereas the second woman, the Black woman, was, I think, a little bit apprehensive of being perceived as too pushy. And she was being so polite. And I wanted to, you know, march up to the nurse's station and be like, this is a woman who is going like very close to the end of her life. She's been waiting 6 hours for morphine. That is absolutely, like, I was angry for her. And I could just see, like, she was trying to be on her best behaviour. And it broke my heart. And it was within a couple hours of each other. I was like, there's two women on the same ward. I don't think it can be any more clear cut. And you're so right about the whole London thing, because my registrar on that job was a black woman and probably one of the best. You know what you see? I don't know if you saw that statistic when it came out about black women being the most educated group in America. It was basically talking about how when there's a group of people who they have to work so hard to be taken seriously and they just end up being exceptional.
Yeah.
This registrar just epitomised that. Like, she was so exceptional in every way. There were so many patients that I went to go see them with her, and I just saw them like light up when they saw her in a way that I would never get that. And that's absolutely okay. You know, it's like working in a team in with colleagues. There are some people that you will click with and some people you won't, and that's okay.
Yeah.
We just need that mix.
Yeah.
Yeah.
You know, I think what you've just said is so, so powerful, and it's so layered. But that example, it's sad and it's horrible, but it's the reality for so many patients and so many patients of colour, where they often feel like they are not heard. And then on the reverse, they feel like they can't speak up because of this, you know, idea that they are going to be perceived as aggressive, or they are going to be perceived as a problem. And that's not just in healthcare. These are things that people of colour go through their whole life. In the workplace, in schools, in university, you are, you know, society kind of shrinks you and silences you because you should fall in line and you shouldn't speak up. Because if you speak up, you're going to, in the case of women, be seen as the angry black woman. And in the case of when it comes to your health, you may not then get the healthcare that you need. So it's a very, very dark reality for a lot of people. And unfortunately, it happens far too often. And, you know, when you do have a healthcare professional that looks like you, subconsciously or consciously, sometimes it just helps a patient open up. It helps a patient sometimes feel safe. And I've had that so many times when I have a patient come into the room and they're like, oh, my daughter. I don't know this person, but they just, you know, they're just happy to see someone that looks like them. They're happy. Often they're proud to see where you've gotten to.
Yeah.
And it's such a nice feeling. And to just sometimes see their guard being let down straight away is amazing. Sometimes it can be the reverse and they feel like they're at home and they're telling you everything about their life and showing you pictures of their kids. But it's so lovely. It's so lovely.
Yeah, it filled my heart with joy as well, seeing it, how they'd react to my registrar. So I can't imagine how it makes you or her feel. I want to talk to you a little bit about your pregnancy, if that's all right. You've said previously that you think the media paints out pregnancy as easy, and that wasn't your experience. What do you wish women knew before they got pregnant?
So much. Too much to be able to fit into this podcast. But, you know, fertility and the pregnancy journey, or the trying to conceive journey, isn't a simple one. You know, I call it the fertility puzzle because there's lots of pieces that need to come together at a certain time to be able to conceive and to have a healthy pregnancy. And it's 50-50 in a sense that when it comes to infertility problems, so not being able to conceive after a year is what we class as infertility of regular trying, it's 50-50. So it's thought to be about 30% due to female issues, 30% due to male issues, and the other 30% either unknown or combined issues. And it's important that we remember that because there's so much stigma and this long-held idea that if a couple is trying and they're not successful, that it's due to the woman. And that's not necessarily the truth. But because a woman has periods, because a woman carries the pregnancy, because a woman gives birth, it must be something to do with the woman. However, we know it's 50-50. And actually we're seeing infertility rates increase in men. So that's one thing that I wish people understood. And then I think secondly, people think that, it's easy, like I said. However, there's only about 6 to 7 days each month where you can possibly get pregnant. So it's not easy. You only have a small window period, what we call the fertility window, where you could possibly get pregnant. And for a lot of people, it can take a while. And for some people, they can't get pregnant through, just having sex. They need assisted methods. Luckily, science has come a long way. And it's amazing when you think about, IVF has not been around that long. But it has had such a huge change and a huge impact on people's lives and their ability to have children. And I think it's fantastic.
Yeah, no, it really is. Considering the 70s, it's just amazing. One of the last topics I want to talk about is your experience on Embarrassing Bodies. Embarrassing Bodies is such an interesting program. Obviously, it's been around for so long. And the most common thing I think you hear about Embarrassing Bodies is, if you're so embarrassed about it, why are you going on national TV? But I think it does an incredible job of making people feel so much more comfortable in going to see their doctor about things that might be embarrassing. Is there a particular story or patient from Embarrassing Bodies that really stuck with you, or funny or emotional, sad, anything?
Yeah, so many. And I think what you said is the reason why I loved the show and I loved doing it, because it really takes that stigma away and makes people realize that nothing is embarrassing. Health affects everyone. And when our health goes wrong, we sometimes need help, and there is help out there. And it makes people realize that, I might have that too. Or she's on national TV showing, all the bits that I thought I couldn't show. That means I can show them, and nobody cares, because it's normal and it's okay, and someone else is going through it. I think one story that I remember, and was definitely one that I won't forget, is a young girl who had alopecia universalis. So alopecia is hair loss, but alopecia universalis is when you have hair loss from top to toe, everywhere. There's no hair on your body. And with this young lady, she'd been back and forth to doctors, trying different things. And she came in with a little bit of hope, I think, that her hair would grow back. And I had to break the reality to her that actually it was probably unlikely that she would get the hair regrowth that she was wanting to see. But luckily there are lots of options that we can help her with. And we helped her get an amazing, fantastic wig that looked like it was sprouting out of her head. We helped her, get some, I've forgotten the word for it now, where you get eyebrows tattooed on. What's it called again?
Like microblading.
Microblading.
Yeah.
We helped her get, some microblading, and all these things to maybe an average person might feel like superficial things. But to her, it gave her a little bit of her life back. It made her feel like a normal 20-year-old, and she could go into the workplace. She could have healthy relationships. It gave her the confidence back that she needed. And to see her come back into clinic with this massive smile on her face, laughing, giggling, so happy. And she was not that way when she first came in to see me. It was just amazing. It was incredible.
I think that's super, super interesting because, so often as doctors, we think that the only way that we can help is through tablets and surgeries and referrals. But actually, sometimes the best thing that we can do is just listen and be honest, and even signposting to a good wig and a good some good microblading. Like, that's just the holistic care I think we should all be striving to give. So I think that's such a lovely story. Before we end, I would like to ask you, what are 3 actions you wish more young women did to protect their long-term health?
Number 1, I always say know you're normal. So if something changes, you're in a better position to spot it and get the help that you need. And that might mean that you get the diagnosis that you need. Or it might mean that you relieve any worries that you might have by speaking to a doctor. But really, really important. Number 2, have conversations. Don't sit in silence, because as women, we often go through the same thing. There's going to be someone else who might be having the same symptoms as you. And not only may it help you, but it may also help someone else. So have conversations. There's no shame in our health. And number 3, remember that you know your body the best. So if someone's challenging you on how you feel about your body, remember you know your body the best, and your doctor should be there to support you, and it should be a collaborative approach.
The no shame point is so important. And if there's one thing we can learn from Embarrassing Bodies, it's that just showing your doctor your genitalia is a lot less daunting than showing your genitalia on national TV. So, I think if that encourages people to put their shame in a box, then that's brilliant. We've been asking all our guests this question. Dr. Tosin, what do you wish every woman knew by the age of 25?
I think not to be afraid to step out of societal expectations. And I think as doctors, sometimes we are afraid to do that because society and the medical system have put this expectation on us of where our career should go and how it will go, and not feeling afraid to step out of that box. Because for me, that's really been amazing. It's changed my career, and I feel like it's helped me reach more people.
And I think it's so, so, so needed, everything that you're doing. So thank you so, so, so much for coming on the podcast. I think there's so many actionable steps that people can take away, and it's just been a joy to have a chat with you. So thank you so much.
Thank you so much for having me. It's been great.